Okay, has it come? Okay, continuing on our classes on viral hepatitis. We covered last time viral hepatitis A and E that was transmitted through the gastrointestinal tract. We were able to say that it is mainly due to problems of sanitation that the transmission takes place. Today we will cover the other viral hepatitis, that is B to D. Rather, we have also got nowadays F, G and others which are there. So we used to initially count, as I was telling you, we earlier had only viral hepatitis A and B, and everything other than that was called non-A, non-B. And then we realized that non-A, non-B also had two different types. One was non-A, non-B, which was transmittable through water and other vehicles, while there was one which was transmittable through blood and other sources. So then it was these other names have been given to these other viral hepatitis. Okay. So here we are, viral hepatitis, enterologically transmitted viral hepatitis A, and we had non-A, non-B hepatitis, which was E, C, B and D, and then parenterally transmitted B and D. Now we come to know that viral hepatitis E is transmitted enterically and viral hepatitis C is parenterally transmitted. F and G and others are coming up, we will not discuss those. Hepatitis B. Formerly it was known as serum hepatitis. It's an acute infection with major pathology in the liver caused by the virus and transmitted through the parenteral route. It is clinically characterized by a tendency for a long incubation period. You see, when we talked about hepatitis A, we said it was the incubation period was 2 to 6 weeks. While here you have the incubation period being much longer, from 45 days to 6 months you can have. It's a very long, protracted incubation period which is there, and protracted illness which can result in a lot of complications. It is endemic throughout the world, tropical and developing countries. It's more in tropical and developing countries. Prevalence depends on behavior, environment and host standards. And you see, hepatitis A is more prevalent in the developing world. Hepatitis B is said to be more prevalent in the developed world, but the big but is the reason why we don't talk about hepatitis B so much prevalent in the developing world is because possibly there are so many cases which are undetected. Okay. Hepatitis B, 66% of the world population living in areas with high levels of infection. More than 2 billion people worldwide have evidence of past or current hepatitis B infection, and 350 million are chronic carriers. So it's a huge amount of cases which we have of hepatitis B and hepatitis C. Also, why we are concerned is 60 to 80% of primary liver cancers are because of this virus, and 5 to 10% of the adults and nearly 80% of the children infected with hepatitis B become carriers. So it's all a very, very big problem which is there, and among that 25% will land up with serious disease. So either it is cirrhosis or cancer, all these problems which are there will occur with this particular virus. So if you start looking at the place, you will be very happy to see that India is in the yellow in this particular slide. But the unfortunate portion is, we in India are really not sure as to whether we should be in the yellow or in the red, because of the fact that the amount of testing which is done is comparatively low. So high incidence areas are those which are greater than 8%, that is 45% of the global population is that. The lifetime risk of infection is greater than 60%, and early childhood infections are common in these particular areas. The intermediate infection areas are 2 to 7%. That is 43% of the global population is in this particular case. Lifetime risk is 20 to 60%, and infections are there in all age groups. While in low infection areas, there are less than 2%, there is 12% of the global population. The lifetime risk of infection is just less than 20%, and mostly in adults. So, if you start looking at where the infection is in a larger group of individuals, it will be there in children. Where the infection is less, then it will come in adulthood. So that is how the breadth of the spectrum is there. So what are the factors which we have as far as this is concerned? Is the agent is hepatitis B virus. It was discovered by Bloomberg in 1963, and as you are well aware, you have done microbiology, you can tell me more about it. The hepatitis B virus has a small spherical 22 nanometer particle. It has tubules of varying lengths, and it has a 42 nanometer Dane particle. You are all well aware, we have read in detail about microbiology. I am not going into details about it. The reservoir of infection is man, and he is the only reservoir of infection. So if you start looking at the infection, the sources of infection, it could be transmitted between family members, because, like, for example, if you look at B and C, they put the slide together, B and C. I think we'll cover this a little later. Let us look at the infective material. The infective material which is there is body fluids. Highly infectious is blood, serum, and wound exudates. Moderately infectious is semen, vaginal fluid, and saliva. And very low amounts are seen in urine, feces, sweat, tears, and breast milk. So we keep on talking about HIV and AIDS, and we were talking a lot about it a few years ago, and we never hardly used to speak about hepatitis B. But the modes of transmission of hepatitis B and HIV are the same. That means transmitted by blood, serum, semen, vaginal fluid, saliva. It's the same mode of transmission as HIV, and if we can control HIV, we should be able to control hepatitis B. So the virus is the Hepna DNA viridae, and is capable of surviving for days in the environmental surfaces. Very easily destroyed by sodium hypochlorite, destroyed by heat, destroyed by autoclaving. Unfortunately, you cannot autoclave your blood. You don't autoclave you see the modes of transmission when you look at blood, serum, semen. So you have or vaginal fluids. None of these is capable of being, you're not able to use these means of sterilization. A period of communicability is a virus present in blood in the late stages of the incubation period and during active episodes of acute and chronic disease. So the virus is present at those times, and several months or until disappearance. The period of communicability is for several months or until disappearance of the spherical antigen which is there, appearance of the surface antibody. Once the antigen disappears, then the surface antibody comes in, and possibly there is some sort of resistance at that time. So what about the age? It is in countries where hepatitis B is common, is relatively uncommon. You have, I mentioned about the age earlier itself. In places where it is rampant, you have it in all age groups, also in children. In places where it is moderately present, it is there in all age groups, but mainly in adults. While in places where it is rare, it is mainly in adults. So that is how it is. Who are the people who are at risk? First and number one is surgeons. people who are exposed to blood and their blood products. So surgeons are one of the most people who are exposed to large numbers. So surgeons are put as number one, or recipients of blood transfusions or personnel dealing with blood, healthcare professionals, laboratory personnel, percutaneous drug abusers, whether it is percutaneous, whether it is IV drug abusers, all types of drug abusers which are foreign natures, homosexuals because and sex workers, all these who can with unprotected sex, or people who have multiple partners, infants of hepatitis B virus carrier mothers, or immunocompromised patients. All these people are the high risk group. The humoral and cellular response is they with the surface antigen before onset, or the surface antigen comes in before onset of symptoms and peaks during the overt disease and declines to undetectable levels after 3 to 6 months. The E antigen and the HBV DNA and the DNA polymerase tests which are there, which can be seen in the serum, and they can the surface antigen when it's present, it shows viral replication. So all these tests can be done for detection of these antigens, or you wait for the antibody response to take place. Antibody response for any infection generally starts coming up in 2 to 3 weeks, and then that time you start getting starts from a week when you start getting the IgM antibodies, and then later on you get the IgG response. You're well aware of all this, you've learned it a lot in microbiology. So even in our present condition, we are talking about rapid antibody tests in COVID. We do get the IgM response in a few days, and then that's replaced by IgG, and we do not know how long that IgG will last in COVID. The anti-HBE, shortly after the disappearance of the HBE antigen, whenever there is a reaction which is to take place, you have an antigen which comes in first, which is the virus, and when the body's response, the antibody comes in. Once the antibody comes in, the antigen generally disappears. You may have antigen particles which are present, and that is the reason why we are looking at PCR tests which are there, which are coming positive in COVID after 2 months. The reason is particles of the virus being present. It's not necessarily a relapse of disease or a reintroduction of the disease. It may be just that the particles of the virus have come up. Ritika, can we have the fan, please? This fan. There, I think. The immunoglobulin anti-M.B.B.S. Same story. I mean, whether you talk about E, C, or anything, we put it in different things. But basically, when the disease first comes the antigen, that is the HBC or the HBE or the HBS, and then you will have the antibody response which is there. The thing which needs to be seen is the HBC antigen and the HBE antigen, which basically is important when you're looking at replication of the virus. Yeah, it's there here, is it? So here's a chart which gives you the surface antigen coming up, and then you will have the antibody to the surface antigen coming up. You have the HBC antigen coming up, and then you will have the response to the HBC or the HBE, anti-HBE coming up. So all these things, first you will have the antigen coming up followed by the antibody response. The antigen can generally be detected by PCR studies, and the antibody through immunoglobulin tests. You can have rapid tests also nowadays available. So this is what takes place after 6 months. You have the antibodies response which can take place, which can last. You have the surface antigen may continue to be there in the body in the body for 6 months or even longer for that matter. Now, modes of transmission, we mentioned that the modes of transmission were blood, serum, the semen, vaginal fluids. These are the major modes of from where the transmission can take place. So let's look at it from the other angle of what will be the modes of transmission parenterally. That is, we've already mentioned IV drug use. You have blood transfusions. You have a surgeon getting a nick, or in what we call a needle stick injury. Needle stick injury, please. Please read up about needle stick injuries. Needle stick injuries are basically the healthcare professionals when they go to give injections, or when they're doing a suturing, or when during a surgery, you can have a pin prick which takes place. You're not too sure whether the person is HIV positive or is positive to hepatitis B, but you have to take precautions. And for that, there are certain guidelines which are there. Not this lecture, but we'll talk about it sometime. What do you do when you have a needle stick injury? Okay, perinatal. Perinatal is an important factor for the high prevalence. It can be transmitted to the child perinatally, and as far as sexual, we have male homosexuals as well as sex workers, who are the ones who are capable of transmitting the disease. Also, people with multiple partners. As we were saying, perinatally as well as horizontal transmission is possible in many parts of the world. You can forget about this particular line. We will not discuss this particular thing because this is a little bit controversial. Blood sucking afterwards is also very controversial. We will not talk about it. The incubation period is 45. Please change this to 45. Yeah, here it is. 45 to 180 days. 45 to 180 days. The average being 60 to 90 days. The clinical illness in less than 5 years old is less than 10%, and more than 5 years, 30 to 50%. You see, what we're talking about is not the age. This is the clinical illness can last for less than 5 years in less than 10% of cases, and greater than 5 years for 30 to 50% of cases. The rest of the cases is indeterminate as such. Acute case fatality is 0.5 to 1%. And the premature mortality from chronic liver disease is 15 to 25%. Okay, let's discuss about what is the prevention of and containment of this disease. The main vaccine earlier used to be a plasma-derived vaccine, and I've got lots of slides on that. I had to delete all those slides because plasma-derived vaccine is today not being used much. We have a recombinant DNA virus vaccine, which is now being used. We also use hepatitis B immunoglobulin for passive immunity and passive active immunity, which we will discuss in detail. Just for completion, the plasma-derived vaccine was surface antigen harvested and purified from hepatitis B carriers, and it was a formalin inactivated subunit viral vaccine which is there. It used to be put in an alum adjuvant and used to be given in a dosage of 0, 1 month and 6 months, or 0, 2 months and 4 months, and there was an effective antibody response, and after 3 doses 95% of the vaccinees had a response, and it used to last for 3 to 5 years, and the booster was given after 3 to 5 years. Currently we have this recombinant DNA vaccine which is there, and this was started in 1987 as a cost-effective vaccine which is as efficacious, if not more efficacious than the previous vaccine. You give it as a 10 to 20 microgram initially. The booster dose at 1 month and 6 months. Okay, forget about all this. About the dosage. The reason is that today we have introduced this into the national immunization schedule. And when is it given? It is given at birth. It's given at birth to the child, and then you give a booster at 6 weeks in the pentavalent vaccine. What is a pentavalent vaccine? Pentavalent vaccine, 5 vaccines. Please, if people can rattle it out, it will be very good. You are not there in front of me for me to ask the questions. Let us see. D, P, T. 3 of them. DPT. 2 remaining. I have already told you one. That is hepatitis B. And the 5th one is Haemophilus influenzae. Haemophilus influenzae. Haemophilus influenzae causes. What does Haemophilus influenzae cause? It doesn't cause influenza. Haemophilus influenzae causes pneumonia. Haemophilus influenzae causes meningitis. Please remember this thing. This is a very common multiple choice question in your exams, and everybody writes Haemophilus influenzae causes influenza. It doesn't, and that's how you lose your marks. Hepatitis B immunoglobulin used in those who are actively exposed to the positive blood of hepatitis B, maybe in surgeons, lab workers, newborns of carrier mothers, sexual contacts of acute hepatitis B patients. They're very rare. Sexual contact of acute hepatitis B patient, very rarely. Mainly in surgeons, lab workers, or newborns of carrier mothers. This is to be given ideally within 6 hours and not later than 48 hours. Though I'll be discussing in detail regarding this, we hardly do use this hepatitis B immunoglobulin. Recommended dose is 0.05 to 0.07 ml per kg in 2 doses 30 days apart. Passive active immunity, basically what you're planning to do is give immunoglobulin and then give hepatitis B vaccine also. So you're combining the passive and the active immunity. Can be given if you have a needle stick injury and you're sure that you've got it from a hepatitis B patient, then you take immunoglobulin. Immunoglobulins themselves per se have got certain problems. They are known for reactions. That's why we don't easily give immunoglobulins to people. So we will talk. I'm sure this has been discussed in microbiology in detail, so I don't want to go in detail about it. The 2 different types of immunoglobulins and how the reactions can take place with immunoglobulins. Okay. What are the other measures? Blood donors. All blood donors today are screened for hepatitis B. All pregnant women are to be screened for hepatitis B. Voluntary blood donation should be encouraged, and purchased blood has got a higher amount of post-transfusion hepatitis. You see, a person who is a professional blood donor, there are professional blood donors who go from one donation camp to another donation camp just to earn money. And this is very common in our country because people are poor, they do not have money, and blood donation, person gets money for the blood donation, also gets a meal to eat. So both these things, for this purpose, you find a lot of people going from one donation camp to another donation camp. Health personnel should follow simple hygienic measures and ensure that they don't get a needle stick injury. Carriers should be told not to share razors, toothbrushes. I don't know who shares toothbrushes, but it's mentioned here, toothbrushes. So toothbrushes, or use barrier methods of contraception. So every person who is a carrier should ensure he uses a condom during the sex, or also ensures that he doesn't donate blood. He should not donate blood. He should ensure that he is not only blood. Now, for example, in COVID times, you would try to donate plasma or any of these things. People are under the impression that if you can't donate blood, you can donate plasma. You cannot do that. So please ensure that your patients are well educated. Hepatitis B patients are well educated so that they don't transmit the disease. Now, there's this elimination of hepatitis B virus transmission program which is there. It was basically for prevention of perinatal hepatitis B transmission. We were to routinely vaccinate all infants, and vaccination of high-risk groups, vaccination of adults. This is all my old slides have come up. Today we are inoculating everybody. As I mentioned, everybody gets a hepatitis B shot, which is there, but it was not so earlier. And all those people who have not got it earlier, especially those who are in the health sector, I think this change took place before y'all were babies. So please ensure that if you all have not taken a hepatitis B shot, please ensure that you take your hepatitis B shots so that you are immune to hepatitis B, which can take place to any health worker with a single needle stick injury. So treatment basically involves giving interferon, lamivudine, and this is for antiviral basically drugs. We will not discuss in detail, that will be discussed with my medical colleagues. Just to mention some things about hepatitis D and hepatitis C. Hepatitis D, just one or two slides. You have a delta antigen and a surface antigen just like hepatitis B. So generally occurs as a co-infection. Severe acute disease takes place. There is a low risk of chronic infection. So sometimes with superinfection you can get chronic liver disease. Percutaneous exposures, you can injections, all similar to hepatitis B. You really don't need these slides to tell you. It's everywhere, and India is in the intermediate zone for this particular infection. Prevention is also similar to what we said of hepatitis D. Hepatitis C. Hepatitis C was identified in 1989, and blood tests became available in 1992. Before that, it was put into the group of non-A, non-B hepatitis. There are so many of them being clubbed together, non-A and non-B hepatitis. It is spread exactly like hepatitis B. No vaccine. Unfortunately, there is no vaccine for hepatitis C. That is the whole problem which is there. There is no vaccine for hepatitis C. In India, we have about 10.9 million people suffering from hepatitis C. And we, of course, this figure has gone down. We have now about 2 million people suffering from AIDS. And so in India, you find that 2% of blood donors have hepatitis C. And this can result in the same way as hepatitis B. You can have hepatocellular cancer and various chronic liver diseases caused due to hepatitis C. So these are figures which are there in 2001, very old figures. You have a large number of people who were suffering from hepatitis C, also a large amount of deaths due to hepatitis C every year. Incubation period is from 2 to 26 weeks, an average of 6 to 7 weeks. The acute illness, it is a mild illness which is there in less than 20% of cases. Case fatality is not very high, it is low, and chronic infection, chronic hepatitis, cirrhosis of liver, all these are diseases which can occur. So chronic infection is in 60 to 85% of cases, chronic hepatitis in 10 to 70% of cases, and cirrhosis in up to 20% of cases. Mortality is about 1 to 5%. So in acute hepatitis C infection, you can either have a recovery or a person can go into chronic infection. That's what you mentioned, 55 to 85%. They can be mild, moderate or severe. Moderate patients can also have cirrhosis of liver and then will move into end-stage liver disease or hepatocellular carcinoma. You can do a liver transplantation, but sometimes may be useful, may not be useful, because hepatitis C may be present in the portion which is not been, if you still continue to have hepatitis C, liver transplantation may not be of much use. Sources of infection of hepatitis C mainly due to drug abusers, which is the sexual route is 15%. Transfusions 10%. Actually, the figure for transmission keeps on going down because today we keep on testing for hepatitis B, hepatitis C in the blood. The problem is occurs due to places which have non-licensed blood transfusion units. It's not permitted in our country, but whatever is not permitted in our country generally takes place. So we do have blood transfusion taking place in places which is not permitted, and that is where we have these transmissions taking place. Otherwise, this should have been nil. Once you are testing, this should have been nil. Occupational, that is basically doctors and healthcare workers, 4% needle stick injuries. So it's quite a large number. Should be careful. So here they say blood transfusion before 1992. That is not for our country. Our country, even you have problems even today. Injectable drug abuses is the maximum cases which take place. Low risk if a person is snorting drugs or using other drugs which are there, or in tattooing or any form of parenteral use. In case of occupational exposure, basically in the healthcare settings, body piercing, acupuncture, using unsterilized needles. This is where you can get hepatitis C. Lower risk is there from pregnant mothers to the child. Non-sexual household contacts, if they are sharing razors, toothbrushes, I doubt if anybody does, but anyhow, toothbrushes should also be mentioned. Sexual transmission is less in monogamous relationship, but in a person who has got multiple partners, it's possible. How do you prevent? Basically, similar to hepatitis B, what is mentioned here is for laymen, that is cover up wounds, do not touch blood, clean blood spills, dispose of needles properly, do not inject drugs, avoid sharing of contaminated articles, and do not donate blood, body organs and semen if you are positive. Practice safe sex. So these are basically the same ways as how do you detect it? We are still looking at the same story of virus. Virus is detected with the PCR studies, and the antibody is detected by hepatitis C antibody studies which are there. Also, there will be problem with the liver function tests. So those may give you an indicator initially, and then you start investigating further. Hepatitis C causes serious problems in some patients: fibrosis, cirrhosis, advanced liver disease, and hepatocellular carcinoma. Nothing much. This is basically slides which I had made of for a layman. So fibrosis occurs in the liver, and advanced liver disease can result in a person having fatigue, difficulty in concentration, jaundice, swelling of his legs. You're talking about fetal edema, fluids, gastrointestinal bleeding, and poor blood clotting. Well, that's all the things which take place in liver problems. Okay. Also, as in hepatitis B, you have hepatocellular carcinoma, which can occur from chronic hepatitis C. And this can be done, and you can treat it with surgery, medications, or liver transplant. This is a study which was done, which says that what are the chances of a person getting cirrhosis. So a non-drinker, if you take it as 1, chances of him getting is 1. If he has hepatitis C, but is a non-drinker, the chances are 9 times more. If he is a drinker with hepatitis C, it is 15 times. And without hepatitis C, so a non-drinker compared to a drinker, a non-drinker, 15 times more chance of cirrhosis is there in a person who consumes alcohol, and 147 times if he has got hepatitis C. One of the studies, you can take it or leave it that way. What are the chances of progression of the disease? If the patient's age is more than 40 years, if he has got HIV co-infection, is male, or has got hepatitis B along with C, then the chances of progression is much more. Also, if person has hepatitis C, one must ensure that he doesn't go in for herbal medications and does not go in for alcohol. Mother to infant transmission does take place, but we can there's no need to determine the mode of delivery based on HCV infection status. You can test the infants born to HCV mothers and keep them under scrutiny. That's what basically you can do, and then evaluate them for chronic liver disease. Okay, this is a slide which gives you a comparative feature between A, B, C, D and E. Source of infection in A was, as we told, was feces, and B was B, C and D is blood and blood fluids. A and E is feces. Route of transmission is A and E is fecal-oral, while these are percutaneous or mucosal. Incubation period for A and E will be 15 to 45 to 60 days in case of E, and in the case of B, C and D, it is about 2 weeks to 6 months. 2 weeks to 6 months, except in case of D, which has got a slightly shorter incubation period. Chronic infection is common in B, C and D, not there in A and E, and prevention is by, in case of hepatitis A, we are not very, though we have a vaccine, it is not very commonly used in our country, and what we require is to ensure safe drinking water, safe vehicles, various other things to keep ourselves. Hand washing is very, very important in A and E, while in B, C and D, we would like to improve the risk-taking behavior, ensure that people don't have multiple sexual partners, ensure condom usage, and also screen blood for before transfusion, and also do a screening for patients of B, C and D, so that we can ensure that they do not become chronic carriers and suffer from the disease. Thank you. That's all that I have for you today. We will go in for the next chapter. I don't really know what the next chapter next time. Okay, thank you very much, and see you next week, same time.